Welcome back. Nigeria has received approval of $400 million in World Bank financing to procure and deploy COVID-19 vaccinations. The World Bank Board of Directors signed off on the financing, which it said would enable Africa's most populous nation to purchase COVID-19 vaccines for 40 million people, which is about 18% of its population, and support vaccine deployment to 110 million people. For more on this story, we're now joined by Dr. Emeka Ugwu, the president of the Nigerian Doctors Forum, South Africa. Dr. Ugwu, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening and greetings to your listeners.
The financing from the World Bank must be welcome news now, isn't it? I mean, what's your thoughts on this?
Yes, it is a welcome development. Also, it came at the time we were celebrating our independence.
Okay, what's your thoughts on this development?
Well, as I said, it is a welcome development, a positive one for that matter, because it has added another layer, positive layer to the arsenals against COVID-19. If judiciously utilized, it will help the country to a large extent in the pursuit against the dreaded disease and in trying to bring it to normalcy. Not only the disease, but the economy and the other devastating effects that COVID-19 has brought to the country. So we are looking forward to it being properly utilized so that the intended advantages will be gotten from it.
So far, Nigeria has administered about 5 million vaccine doses to its 200 million citizens. Why do you think the government has lagged so far behind in its vaccination program?
Yes, you are right. From what I've read, it's less than 1% of the population that have so far been vaccinated. It could be a combination of factors. One is the speed at which the vaccines were procured from various sources. The second could be the hesitancy from the population from accepting the vaccination, which we also see in other countries. And the reason for this could be multifaceted. To start with, from records, available records, the number of cases of COVID-19 in Nigeria is relatively low compared to other countries of similar populations, and even compared to other countries in Africa. We're looking at about just above 200,000 cases that they've recorded. So because of that number, people may be hesitant to take COVID-19 vaccine because some people may think that their chances of getting the infection may be low. As I said, it could be a combination of factors.
Yeah. And just how severe has Nigeria been affected by the COVID-19 pandemic, particularly the Delta variant?
Particularly
the Delta variant.
Oh, yeah. The Delta variant got to Nigeria. It hit Nigeria. But as I said, the total number is relatively low compared to other nations. As of today, they had about 207,000 cases altogether since the inception of COVID-19, and they have about approximately 6,000 active cases. So it's not so much, so to say. But these are statistics that are available. I must say that I don't think that the rate of testing for COVID-19 is as aggressive as it is in a country like South Africa. So that could be the other factor. But all in all, the number of people that we're seeing dying in that country is not that huge. That cannot be accounted for other illnesses or other diseases.
Now, Dr. Ugwu, let's talk about the overall health system and how much strengthening the government would have to undertake to ensure that all the health systems and all the checks and balances are made to ensure that there is a stable health system in Nigeria.
Yes, there has been a decadence over the years, and successive governments hadn't done anything very practical to reverse the trend our decaying health system in at various levels of government. So it is our hope and our prayer that this time around, with this kind of money, they will put it into good use, such that in addition to just acquisition and procurement of the vaccine and the distribution, this money could go a long way also to help in maintenance of adequate conditions in terms of the vaccine, the cold chain, building of other facilities, which may assist the country in various other forms apart from COVID-19. Help increasing the capacity for testing for COVID-19 also, and perhaps a collating of data and the management of data, and the proper surveillance of the COVID-19 disease and in fact other diseases in the country. Building infrastructure and the human capacity that will help to stabilize our health system at various levels. So it is our wish and our hope that this government will take the bull by the horn and not just pay lip services to what the situation is like, but to be practical, to have their hands on deck to ensure that the needful is done.
And perhaps one of the key preventive mechanisms is the non-pharmaceutical interventions to prevent the spread of COVID-19. And considering Nigeria being the most populous nation on the continent, what are you seeing on the ground, Dr. Ugwu, in terms of adherence to, these non-pharmaceutical interventions, such as social distancing and mask wearing? Well,
the adherence to that is very, very low from what we see on the ground and what we hear from people on ground equally. In a place like Lagos that has a population of between 20 and 25 million, your guess is as good as mine how possible it is in certain circumstances for people to observe social distancing. But in addition to social functions in churches and other religious gathering and social gathering, you scarcely see people or majority of people wearing a mask. That's not what we see on ground. So social distancing and the other non-pharmaceutical and non-pharmacological remedies are not all that being adhered to. But that brings another question to the meat. We don't know why the rate of COVID is still low in Nigeria in spite of all these anomalies. It's a point that researchers should look into, and perhaps that will help the world.
Okay, Dr. Ugwu, great chatting to you. Thank you so much for joining us this evening.